The KwaZulu-Natal province is fearing a resurgence of COVID-19 in the province. The Health MEC says it's a cause for alarm that the number of new cases over a 24-hour period jumped above 1,700 over the weekend. That was on Saturday. Overall, South Africa has seen a sharp increase in COVID-19 cases, but it hasn't officially entered a fifth wave. Saturday represented a several-month high of new cases at over 6,500 in a day nationally, with Gauteng and Kwazulu-Natal accounting for the vast majority of new cases. To discuss, we're joined by Professor Saloshni Naidoo, Head of Public Health Medicine from the University of KwaZulu-Natal School of Nursing and Public Health. Professor, thank you for being with us. We saw the numbers go up until Saturday. Since then, there's been a bit of a pullback, in fact. Is that a cause for relief or just a product, perhaps, of a long weekend?
If we look at what's happened from the 23rd of April until the 30th of April, we've actually had an increase in the numbers, and we've gone from
All right, technical issues are affecting that interview. Let's see if we can get our guest up perhaps on the phone. But let me give you an idea of that pullback. So on Saturday, we saw these incredible numbers, 6,500 nationally, and in KwaZulu-Natal over 1,700. Yesterday, the numbers were much lower, 2,600 or so new cases nationally, and only 619 in KwaZulu-Natal. Professor, I believe that you are with us again. You were explaining these numbers and whether or not we can be relieved that they've at least gone down since Saturday, but of course we've had a long weekend.
Well, generally what happens, people tend not to test on a long weekend, and so our numbers will drop. What we need to do is now look at numbers over the next 4 or 5 days, which will tell us what's really happening at the coalface. And as I've mentioned earlier on, in the first 7 days, from the 23rd to the 30th of April, we actually did see an increase in the numbers. And our 7-day rolling average has been about 20% for the province, in keeping with what we're seeing nationally as well.
Yes. Are you one of those who believe that we are entering the fifth wave?
You know, in the next 2 weeks or so, we will see what really is going to happen. But we probably are going to have an increase in the number of infections, but we may not have as many deaths and hospital admissions or serious hospital admissions as we saw maybe in the second wave. So this wave may actually behave more like what we saw in the fourth wave, where there's this uncoupling in the number of infections that we see within communities.
And that is the hope, that this decoupling continues. Gauteng has higher numbers, the highest of all, but KwaZulu-Natal is of specific concern, isn't it? Given the water issues there and the damage from the flooding. Professor, are you with us? All right, sorry, yes. we couldn't hear your response, so I was asking if KwaZulu-Natal is a province of specific concern.
Yes, well, with the flooding, what's happened is several people have been left homeless, and we have groups of people congregating in school halls, in community halls, and in churches. And so you have this potentially being an environment where you can have increased transmission of infection. And also, we don't have access to good sanitation water because of, and so asking people to sanitize and asking people to wash their hands becomes a bit difficult in this current situation. So with the challenges that we are facing in the province, there's definitely cause for concern that the risk and the environment is being created for greater transmission of disease.
All right, Professor, this line keeps on cutting, but we are understanding you. And let me throw in one final question. What is the situation, as far as you know, in hospitals, given what you've outlined? eThekwini, I understand, accounts for about 80% of the new cases, and eThekwini has also been hardest hit by the flooding. What are the hospitals looking like there?
So based on the reports that are coming out, we have an increase in hospital admissions. We've seen a slight increase in ICU admissions as well, and also the number of patients on ventilators. But it is nothing as the pressure on the hospitals is not as great as it was in the case of the second wave. So it's not going to be, or it's hopefully not going to be as serious as we've previously seen in maybe the second wave.
All right, thank you for your time tonight. Professor Saloshni Naidoo from the University of KwaZulu-Natal School of Nursing and Public Health.